Angelina is 10 years old. She cannot see, hear, eat, walk, talk, or even poop normally. Yet, in our country, she is not considered disabled enough to receive disability benefits. As the aunt of a lifelong disabled child, I know firsthand of the financial troubles that a family can go through when raising their disabled child. All lifelong disabled children should receive disability benefits. Because there's an added care involved in caring for a lifelong disabled child, all children with lifelong disabilities should receive disability coverage regardless of their parents' income. First, let's look at what children's families go through in raising their children with lifelong disabilities. Profoundly disabled children require a lot of added care. My niece Angelina has Charge syndrome. It is a genetic disorder that she was born with. It leaves her deaf and blind. Very low muscle tone causes her to still be working on mobility at age 10. She also cannot swallow properly, so she is fed with a G-tube. And soon after her birth, her large bowel ruptured, causing her to have an ileostomy or a poop bag on her tummy. Just going through a normal day requires many one-on-one care hours. According to an article from 2014, Child and Family Social Work Journal, all this added care causes a lot of added stress on the family due to financial responsibilities, medical worries, and medical bills. The lifelong disabled child will need care from her family for her entire span of her life. According to the Professional Journal of Physical Therapy from July 2014, the financial, medical, physical, and emotional challenges still remain for children, despite the medical advances that has provided longer life. The costs of medical supplies, therapies, medical equipment, nutrition, and medicine for their disabled child will be far and above what a normal family with normal children would experience. Care needs are around the clock. According to a survey published in the Journal of Nursing Children and Young People from April 2013, parents stated that their greatest area of unmet need in caring for their disabled child was the need for respite care. Second, now that we know that having a profoundly disabled child will impact the family, let's look at what we can do to help the family. Social Security benefits should be provided to children with profound disabilities, with lifelong disabilities, regardless of their parents' income. According to the book Foundations of Nursing in the Community by Stanhope and Lancaster, all end-stage renal disease patients are afforded Medicare coverage in order to pay for their life-sustaining dialysis treatments. End-stage renal disease patients need this in order to survive. They should get Medicare coverage. But we should also take care of the disabled children in our country. Just like renal disease patients cannot survive without their dialysis treatments, disabled children cannot survive without their family. Give them the benefits they need in order to be able to care for their profoundly disabled child. According to the Journal for Rehabilitation Pediatric Medicine from February 2014, Many children do not qualify for benefits simply because their parents' income is too high. These families are struggling not only to come to terms with the disability their child faces, the care demands that this brings, the cost of that care, but now they feel impoverished and degraded when they ask for help and support in order to meet the needs that are extraordinary in the raising of their profoundly disabled child. One example from my niece is the cost of her diapers, which exceeds $4,000 a year. This doesn't even come into consideration for the hearing aids, walker, wheelchair, feeding supplies, ostomy supplies, and different therapies that she needs. All of these costs add up quickly in a family. A study cited on the website Public Health Reports, last accessed September 18, 2015, cites that the burden of the cost of care for a disabled child can be in excess of 5% and up to 12% of the total income of a family. Allowing disabilities for the child would help to offset some of the costs of this care, help pay for some respite care, and allow the family to raise their child. This same study also cites that support for the family is the most cost-effective use of the state's monies. Parents want to take care of their own child. They want to raise their disabled child. Afford them the ability to take care of their lifelong disabled child without financial ruin. Let's review. Our country affords Medicare coverage to all end-stage renal disease patients in order that they can receive their life-saving dialysis treatments. We as a country should also afford lifelong disabled children benefits so that their family can survive and care for and raise their child. Call your Senators Dick Durbin and Mark Kirk and your Representative Robin Kelly. Urge them to enact and support bills that would change the requirements for Social Security disability coverage for lifelong disabled children. Keep the families with disabled children together. Allow them to survive and thrive and raise their disabled child. The family is the best place for the child.